Hello, everyone, and welcome back to What After Dentistry. Every now and then, we keep hearing that dentistry is saturated in India. But do you know that in a population of 1.3 billion, only 5 to 10% consume dental services? So, in such a situation, it is required that dental practices continually grow even in the face of competition. For this, one needs to be aware not only of good clinical practice, but also of business intelligence. A combination of technical expertise along with business awareness is essential for the sustainable growth of any dental practice in the current situation. Today's video will focus on how to integrate business intelligence to grow your dental practice. And to discuss this, we again have Dr. Krishnaraj Ganesh Narayan, founder and consultant at Delta Dental Care. He also founded Delta Dental Academy, which focuses on providing dental practice management workshops and courses from a business intelligence perspective. I hope this conversation will help you to create a roadmap of how you can start growing your practice by the simplest of action points mentioned by Sir. Let's hear. Hi, sir. Welcome back once again on our channel, What After Dentistry, to talk about how to run a successful practice after COVID. So, welcome you once again.
Thank you, Dr. Shirin. Always a pleasure.
So, sir, I'll start my question with a it's kind of a debatable question. So, and it's unfair to, address this fact that we are in the current situation that we are in today. Dentistry in India today, everyone says it's saturated. There are less clinical jobs. Even the dentist population ratio is, it's against the recommended WHO value. So, in such a situation, how do you motivate dental graduates to stick to dentistry and practice dentistry in the long run?
See, a common mistake that, again, like you said, saturation is such a common word that is being used. Now, I have seen many dentists, they always say, sir, there is a lot of saturation in this area. So I always tell them this. Okay, you find a place where there are no dentists, okay, and you feel that this is an excellent potential area because there are no dentists around. And you start a clinic there and you're extremely successful, right? And I come that place and I see, oh, Dr. Shirin has started a clinic here, and oh, in 2 years she has bought a BMW or a Mercedes, so that much his practice is good. What is going to happen? I'm going to open a clinic there, right? So having a place which has no dentist is no guarantee that you're going to get a success for the rest of your life. A successful practice is not defined by your competition. A successful practice is defined by how you devise your practice, right? So don't be in competition with anybody else. Be in competition with yourself. What you were last month, what you were the month before, what you were 2 months before, 6 months before, year before. You have to keep growing. And if you are not growing, then you are falling, right? So the only competition that is healthy is the one that is with yourself. So whether it is saturation, whether too many dentists, price, people are charging lesser, I cannot. That's immaterial. Immaterial. Yes, you have to do your market study properly. You can't practice dentistry in an area, certain types of dentistry in an area where there is no awareness of dentistry, of the kind of practice that you want to do. So I made that mistake once. I opened a practice as a periodontist. I wanted to do all this aesthetic work and periodontal plastic surgeries and stuff like that. And opened a practice in an area with people don't know how to brush their teeth. There are no problems with removing their front teeth and not getting it replaced. And then I was extremely frustrated that perio has no scope. It means I have not understood my market. So if you understand your market and either adjust your dental treatments to the market that you're serving, or change your market to the kind of dentistry that you want to practice. So if there is a mismatch, you will not be successful. So understand this, then you'll be successful.
Correct. I think this is a very good, point that you have mentioned, that one should definitely study the market area where they intend to set up their clinic, because that's very, very important. Yes. And sir, I asked you this question in the previous session also. So I'm going to repeat this question here, because here we are talking about specifically about how to, have a successful practice. Now we know that pandemic has shaped dental education. There was less of practical or clinical exposure, both for BDS graduates and MDS graduates. So, keeping this in mind, what would you recommend to fresh graduates? When should they start their practice?
See, for anybody to start a practice, there are two very, very important things that you must know. For any business to be successful, first of all, I hope you consider this a business, because anything that you're taking money and to render service is a business. And if you want to be successful in your business, there are two key competencies that are required. One is your domain competency. Right? Domain competency is what for us dentistry. So if you are not good in your dentistry, learn. There are many courses available. Work under somebody, take some courses, learn to do a proper RCT, learn to do proper extractions, learn to do a proper diagnosis treatment planning, and stuff like that. Right. So one is your domain competency. It's very critical. Second is the business competency. You must know what all the things, what are the ingredients for you want to make a good biryani, and you don't have salt, you don't have the necessary ingredients, you will not have a tasty biryani. So you must know the ingredients for a successful practice. So the two main ingredients: you must be good in your dentistry and you must be good in business. If you are good in dentistry and not good in business, there is scope for you, you can still learn. But if you're not good in dentistry but good in business, then God save your patients.
Correct. I think.
So get these two competencies correct, then automatically things will fall in place.
Correct, sir. Correct. And so, what are the basic equipments that one should focus on while they are starting off? Because even in starting, they will start using lasers. They don't know how to use it, but they will still buy it and keep it as a showpiece. And there are like even the dental chair. They'll buy a very hi-fi dental chair, which might not be required, like you mentioned, for that area. It might not be required. The market is not allowing you to use such kind of. So for these, I mean, like for just a basic equipments that one should actually focus on while they're starting out.
Okay. See, the equipments is more or less nowadays standard, right? You obviously need a good dental chair. A good dental chair does not mean an expensive dental chair. A good dental chair is a one that has a good motor, that has a good backrest. It has got an articulated headrest so that the patient is comfortable. It has low working height or whatever based, so the comfort of your thing. And you have a good operator stool. You have other things there. You have a motorized suction and stuff like that. And you have the possibility of attaching a monitor. All that some basic you get even from basic chairs. But what you should look at more is getting a good sterilization stuff, right? You focus on getting. I still go to clinics and I see people, they will spend 5 lakh rupees on a chair, but they will not spend a lakh of rupees on a good autoclave. So get your priorities right. The priorities has to be the safety of your patient. So always every clinic should have fundamentally some objectives, right? You should provide good treatments. You should provide it in a safe environment. So if you are not comfortable treating your parents, your spouse, or your children on the chair, you should not treat your patients. So for that, whatever safety of your patients, what is required, that is comes first. So invest in a good autoclave. Invest in a good, a system, RVG. So what happens is you want lesser radiation exposure, you want good quality images, you want immediate images, you want to invest in good quality equipments, not rust and stuff like that. Whereas invest a little more, spend a little bit more in getting good quality instruments, getting good quality autoclaves and something, rather than going all out and spending so much money. So get your priorities right, and invest in important things. Get a good compressor, right? Lot of people, they just go for a cheap compressor. So don't do that. Get a good compressor. You want a good compressor to have a dry compressor, you want to have an oil free compressor, you want to have a motorized suction, and there are things that you should probably invest in. You should have a septic tank to disinfect the solutions, those the infectious waste. Get a good biomedical waste unit, and try to reduce your recycles. And these are the things that I think you should invest more, rather than putting hi-fi LED lights and things like that. So my advice is you first get your budget for this sorted. Then whatever is remaining, you can design and decorate your office space.
Correct, sir. And since you mentioned about budget, we know like after COVID, a lot of things had the prices have increased. There's a lot of inflation happening. So, if you could give an approximate like budget, which would a fresh graduate would need to start their clinic.
See, if you want a decent chair with decent equipments and stuff, apart from the interior, roughly around 10 to 12 lakhs is going to cost. 10 lakhs. 10 lakhs it's going to cost you to get a decent compressor, get a decent autoclave, get a decent chair, two-chair clinic and stuff like that. And your interiors may roughly cost you about 700 to 800 rupees per square foot. So if your clinic is 1,000 square feet, you think 8 lakhs. If you're 500 square feet, you think 4 lakhs. So that's a decent interior, not a high-fi interior, a decent interior. So roughly about 15 lakhs to 20 lakhs is what you would need to set up a decent clinic. When you set up a clinic, you also have to factor in mind there are two types of expenses. You have capital expenses that are one-time expenses. You have operational expenses that you incur every month. So when you calculate your operational expenses, which means your salaries and your rentals and your electricity bills, material charges, lab charges, and everything, and 6 month worth of your operational expenses cost should be added to the capital expense and keep that in your bank account ready when you start, so that you're not pressured to earn money from day one, because the first 6 months of your practice, trust me, you will not get that much patience, you will not even do break even business. But if you're pressured for money at that time, you will start doing unethical things, or you will start getting frustrated more. So focus the 6 months on establishing a credibility for yourself more than anything else. So include that 6 months of operational expenses also into your capital expenses, which is another 5 lakh rupees, so that you are mentally stress free.
Correct, absolutely. And so, 5 important tips that can help the fresh, especially the fresh graduates, even practicing dentists, to have a good influx of patients.
Oh, good influx of patients. Okay, so you're talking about not the entire, just influx of patients. See, firstly, marketing is definitely important. So if you're not doing any, I see a lot of people saying that I don't want to do marketing because I have my own patients, even established practitioners. If you're not doing marketing, then you are only becoming a service company for your existing patients. Right? You cannot become a service company for existing patients if you want to grow. If your business is to grow, you need new clients, new patients. So that page, to get that new patients, you need to do marketing. So there are many people who say that, "Arey, I'm not very good in English. I'm camera shy. I don't want to make videos. I don't want to do that stuff. I will first learn how to speak proper English, or I will first see India is a country where even today 90% of the people are not comfortable with English. So don't wait for the day that you will become perfect before you start marketing. Whatever it is, start doing. So making good videos is extremely important to so if I want to make a video to my patients and I tell them, oh, मैं बहुत अच्छा dentist हूँ, मेरे पास आओ, that's not right. So how you make a video, there are some tips and tricks on how you have to make the videos. You have to give the content which the patient wants to listen. So these videos can be in the form of different ways. You can have frequently asked questions. You can have tips and tricks, or ask your dentist, or know these things before you go for this procedure. How the side effects of this treatment? How the post-operative instructions after this treatment? So you can make these videos and send it across to patients or potential patients who can see this. And the idea behind this is two things. One is obviously you want lead generation, which means you want patients to come in. And second, the second objective of these videos is to establish a credibility for yourself. So when the patients listen to what you have to speak, now you are listening to what I'm speaking, and your audience is going to listen to what I'm speaking. If I don't have any credibility, they're not going to give me any interest. Right? That's the whole message. So building a credibility for yourself by giving points to the audience which they identify with is very, very important. So start from there. Start with what your patient will experience, and then take them across that journey of how that improves your credit. So that's making good marketing. Start getting patient reviews and testimonials from patients, both in terms of Google reviews, in terms of videos of patients, and putting those up is also very, very critical in getting yourself known in the local area. Third is doing, obviously, community outreach programs. You can do a dental camp. You can do with schools. You can give health talks. You can do tie-ups and MOUs with companies around you. Find out the local areas. Get the HR of the companies around you. Do a health talk with people. Do a dental checkup camp for those people. So that improves the credibility. You will get the pay. It's not like a retail store where the day you open, many people are going to walk in and come. So over a period of time, people are going to come in and then establish only when they have a problem, they are going to come. But the thing is, when they get a problem, they should remember you. They should recognize you. So doing this programs, consistency is very, very important. So doing any of these activities consistently. So many people will think that, अरे मैंने pamphlet डाला, मैंने marketing किया, I did all this, but I did it for 1 month and I didn't see any new patients coming in and I stopped doing it. No, it has to be a consistent foundational consistency in any aspect is very, very critical. And yeah, and then once you get a lead generation, following up on the lead, right? Why a patient should come to you, and why a patient should not go to somebody else. So today, I don't mind a patient walks into my clinic and asks me a bunch of questions and does not undergo treatment from me and goes to somebody else and undergoes the treatment thinking that Dr. Krishnaraj is expensive. I don't have a problem with that. But I have a lot of problem if a patient comes in and goes back and saying that there's no difference between Dr. Krishnaraj and any other clinic. So how you make your customers feel when they leave your clinic is very critical. And the last point, if you want me to say, is uh, give a value to a patient where they feel the amount of money that they have paid you and the service that you've gotten in return is greater than the money that they have paid. That's when you will start getting word of mouth referrals and stuff like that. And be open about asking for referrals. I see this many hesitancy in dentists saying that, how can I ask a patient to refer more patients? But don't do that. You ask a patient, say, sir, I am a new clinic. I hope you're happy with my service. I need to grow. I need your support. Here are a few of my business cards. Please give it to your friends and refer me so that I can start growing my business. So there's nothing wrong in it. So please do that.
Correct, sir. Absolutely. I think this is one of the, we have had these kind of conversations with previous dentists also, but what pointers you have given, I think this is amazing. And one should definitely work on these points. Yes. So, sir, uh, coming to the business skills, so what are the basic business skills that one should learn and acquire and then implement in their practice?
See, any business, whether it is dentistry or any business in the world, there are some foundational activities that any business should do. And what are these foundational activities? And I'll tell you, marketing is the first one, right? So any business has to do marketing to get leads and to improve their visibility and to improve their credibility. And this marketing is a foundational activity that has to be performed by every dentist, whether you do it yourself or you get an outsource it to an agency that does it. And this could be in terms of blogs, it could be in terms of vlogs, it could be in terms of patient reviews, testimonials, whatever it is. Offline marketing, online marketing, camps, outreach programs, talks, to everything and anything, everything that comes under the gamut. And the percentage of each of this will vary upon your area. So there are very old age people in your area. They're not gonna sit and listen to online talks from you. They would rather have a personal meet, or they would rather read a brochure or something like that. So marketing. Second is operations, right? So when you talk about operations, it means creating value and happiness for your patients and for your team members. So if you have a receptionist, if you have a doctor who's working for you, if you have an assistant who's working for you, and these people are not happy, they are not going to perform at their optimal level, right? So I have this pyramid that I always tell, if you want to be successful, right, a successful clinic should have good results. And the good results come only when there is performance. And the performance will come only from a committed team. And the team will be committed only when there is good relationships, right? So in this pyramid, you have success, which comes from results comes from performance comes from commitment comes from energy levels comes from relationships. So if you have good relationship with your team members, you will get their energy levels high. When their energy levels are high, they become committed. When they are committed, they perform. When they perform, they give you the results, and that is ultimately your success. So that is operations, creating value and happiness for both your customers as well as your team members. Third thing is the sales. So obviously you have to sell your service, right? So when do you sell your service? You sell your service to people who are in need. So not because of value. If somebody says that I will give you a cheaper root canal, I will give you a cheaper treatment, that's not the way you sell it. So you have two patients, one who says that if you give me 1,000 rupees cheaper, I will undergo treatment from you. There's another patient who says, I don't mind spending 1,000 rupees more, but I want to get treated by you. And that difference comes when the patient perceives that the value of services that they're getting is greater than the money that they have charged. For that, when you talk about sales, the communication skills that are essential for a dentist to speak to the patient in order to earn their trust and credibility is extremely important. So that is third, that is sales, right? Then you have accounts. So you have to be good with your accounts. So you have to keep growing your account book. So which means that your top line has to keep growing. You have to control your expenses. So you have to have your negotiate with your vendors, negotiate with your landlords, negotiate with your labs to reduce your costs. At the same time, try to push the business up so that your top line is higher, your bottom line is lower, so the interim profit is higher. So, and then you have to get your statutory compliances and things to maintain proper order. The fourth or the fifth thing is R&D. So research and development. It's not like sitting in a lab and doing research. Research and development of your products and services is important because it is not possible to sell the same product and the same service to the same patients and expect the same amount of money over a period of time, because as the time goes, the rentals are going to increase, salaries are going to increase, material costs are going to increase. But if you sell the same product at the same cost to the same patient, your margins are going to keep decreasing. So you have to find newer ways of innovating your services and start including more and more services into your repertoire that will give you the advantage over other clinics. Right? So doing a consistent R&D is important. Finally, you as a business owner cannot focus on all these nitty-gritties. Have some backup team for yourself. Have a backup dentist, have backup people who can take this responsibility. And your responsibility is to ensure that you get the best out of your team. By how you get the best out of your team is by giving them clarity of what is this that they are supposed to do, what is this that I'm expecting of you. So to give them the role clarity is extremely important. Grow your business. What is it strategically? How do I grow my business? Whether it is in adding more infrastructure here or opening more branches or doing a strategic tie-up or doing a shop-in-shop model, newer business models. So as a business owner, your responsibility is to grow the business. If you are only sitting and doing the marketing, you are only sitting and doing the sales, you are only sitting and doing the audits, you are only sitting and doing the business intelligence, it's not going to work out. So you need to build a good team so that you can come up with certain strategies that will help you in growing your business.
Correct, sir. Absolutely correct. I think these are very, very important points. I'm just curious, like if you look at the Western world, they have this concept of having dental practice managers, who can help the clinicians or dentists basically to leverage the management skills that they have learned. Why don't we have this kind of concept in India?
But पहला तो business बढ़ाओ, so they can afford to pay a dental practice manager. So the problem with the practice in Western countries and in India is there's a lot of insurance component in the money that comes in. So you have an orthodontic clinic who has 800 running cases in US. In India, 800 an orthodontist cannot think of having 800 running practice, even among all his clinic put together. I mean, very few, maybe one or two may have, but most of the people cannot afford to have that kind of. So they can afford to have that because they have a good insurance program. In India, because we don't have insurance and it's fee for service, patients will come only when they have pain, right? And if you want to grow your business, let's put it like this. And if a patient comes to you with a pain in the lower right region of the jaw since 3 days, and you have a root canal and a crown, you get about 8,000 or 10,000 rupees from that case, or 15,000 from the case, depending on which area you're practicing. And the patient has got a missing 3/6 and a 3/8 or impacted or some other thing. You give a total estimate of 1 lakh rupees. Patient not going to undergo even the chief complaint, right? So the only way that we grow our business today is comprehensive care. So in comprehensive care, you first have to make sure that the chief complaint is treated properly, and then slowly start expanding the scope of services to include all the other aspects. And that comes when you build a credibility for yourself. So first you get established. Once you grow your practice to that level, many people stagnate. I'm happy. I have my own client of patients and I'm happy. I go and come back. I'm sitting peacefully. I eat good food. I get good sleep. I bought a BMW car and enough, because they feel that's all that they can achieve. And that's when the problem starts going on. So till you reach that level, do your hard work. Don't stop after that. After that time, you get a practice manager, you delegate, and then you start to the next level. This is where the stagnation of practice is. So even today, I'll tell you, if there are dentists who do the business properly, there is beyond an imaginable scope of dentistry in India, because even with the kind of business that we're doing, with the number of dentists that we have, only 7% of the populace is visiting the dentist. So imagine the amount of scope that is there when more people start coming in. And as dentists, we have to take that collective responsibility of ensuring that we get more people to come in.
Correct, correct. Absolutely correct, sir. So, sir, like you mentioned, in the starting that there are two major areas where one should focus on. One is the clinical aspect and the business aspect to run a clinic. But today, we get questions from the audience saying that, should I focus more on in improving my practice as a business, or should I just focus on providing quality care to my patients irrespective of the cost factor? Like you mentioned that there are, the clinics in my own area, they might be having very competitive pricing. So how do I, as a fresh graduate, how do I keep my pricing?
Okay. See, I'll put it in a very simple way. Your first 2-3 years of practice, forget about making money. Don't even look at taking any money home. Whatever money you earn that is extra apart from your eating expenses, reinvest it back into the clinic to upgrade your infrastructure and whatever stuff. The idea is you should establish a credibility for yourself. And in India, the best way to achieve credibility is by treating a lot of patients. And today, India is a price sensitive market. So any business you see today, they will start with lower prices, right? So the idea is you treat more people, get your credibility in, and slowly start improving your services. This is the standard way of a fresh graduate.
Correct.
If you want to start big, right, don't start immediately. Wait 5 years, work in somebody's clinic, work with me, work with somebody else, somebody who's or someone whose practice is better than me, or somebody work for 5, 6 years. Know your market, know where exactly you want to start. If you want to focus only on say dental implants and stuff like that, you cannot open a small clinic. You need to provide the ambience, you need to provide the infrastructure that is necessary for that. So then you can start directly scale up your practice to that level. But that cannot be done by somebody who's a fresh graduate.
Correct.
So if you're a fresh graduate wanting to open a clinic, start small. Don't put all your money. Start with the basic equipment infrastructure that is needed. Build your credibility. Once you are credible enough, then you slowly start increasing your prices, because you are not charging for the treatment. You are charging for your service and your time. Today, your time and your service has zero value because you are zero.
Correct.
Once you build a credibility for yourself, then you can start valuing your time and your service. Till such a time, keep your prices low. This will
Correct.
be my advice.
Correct. Absolutely correct, sir. So, sir, we also know that many dental clinics today they go for NABH accreditation. How beneficial it is to get an accreditation by NABH?
See, one thing that good thing that has happened, I would say, because of the COVID in India is the level of hygiene, the awareness of hygiene has improved even among the common man.
Correct.
So in our clinic, so fumigation of dental operatories were being done since 15 years. But now everybody wants to do the fumigation and everybody wants to do. So one of the good things that happened because of the COVID was because patients started realizing the hygiene procedures. Now, same way, when you look at an accreditation, whether it is with the NABH or whether JCI, or you look at any of the international or the national bodies that look at accreditations, what it basically accredits you for, it accredits you that you are an organized person, like an ISO or anything. It gives you an emblem that notifies people that you are following certain standards which are recommended for good clinical practice. So two things happen with that. When you improve your own systems, you come up with things that you can improve your system further, right? If you see, the point is why a system is needed. Why are systems needed in any business? Simple. अभी आप जिम जाते हो, है ना? जिम जाते हो बॉडी बनाने के लिए, वेट लॉस करने के लिए, you become fit, you become strength, you strengthen yourself. Why do you do that? So that when you are sick, your body has enough strength to take care of you. When your body is sick, you cannot go to the gym. So the idea is when you are normal, do good things so that it will take care of you in difficult times. So the point of having an accreditation, a point is to create systems and strategies that will work whether you are a part of the business or you're not there in the business. Many clinics suffer from कि मैं clinic में जाता हूँ तो आज collection होता है. When I'm not there in the clinic, the collection is zero or very minimal. Why does that happen? Because I have to be present. If I create a system and strategy that even if I'm not there, business will continue to happen. Or patients are taken care of properly. So if you have a proper system that this is the way that the patient should be welcomed, this is the registration process, this is the treatment coordination process, this is our lab timeline, this is our inventory checklist, this is our maintenance program. So you have these protocols, standard operating procedures that you have made for yourself. The clinic, whether you get an accreditation or not, you have developed a system that your clinic will follow to improve your practice. You will find that your system becomes more efficient, your wastage becomes lesser, your productivity increases, your efficiency increases, and your accreditation is only a sign of that. So the first thing, the benefit that comes with an accreditation is you get a system that is important for building a good foundation. The second thing is obviously when patients come in and they see that you're accredited, there's a credibility boost that comes with this. So definitely getting an accreditation is beneficial, but don't go overboard and trying to get 20, 30 accreditations here and there and all that. Have a basic system, get a good accreditation and should be good.
Thanks, that's good. And so, what are the 5 common mistakes that you see dental graduates or practicing dentists make in their practice?
Forget common graduates, so they should make mistakes, because young graduates, if they don't make mistake, you never learn. So I have made every possible mistake that a practitioner should make. So, but established practices, what mistakes they make, most commonly, what I can say is simple things. Okay, it's nothing that I'm going to say is something that you don't know or the practitioners themselves don't. When a patient's appointment is given at 10 o'clock in the morning for scaling or for root canal, what time should the treatment start?
10.
10. 95% of the clinics, this doesn't happen. So the patient, when they come, they don't want to spend time with you, right? They don't want to spend time with any of us because there's the last thing they want to do is to go to the dentist. Nobody gets up in the morning and says, "Arey, wow, let's go to the dentist today." Right? They're coming because they don't have a choice. They feel like that bali ka bakra. They're waiting to get their neck chopped off, and then you're making them wait. So that's not a good thing. So common mistake, waiting time. Second mistake that I commonly see: patients are not given proper explanation. Which means, say for example, you have an endodontist coming to your clinic for a patient, and you have said you need to undergo root canal. Our root canal specialist will come; they will do the root canal for you. Now the endodontist comes. It could be an orthodontist, endodontist, oral surgeon. I have nothing against endodontist. Just saying in any specialty. That person comes, Are, who told that this root canal can be done? Are, this tooth is no prognosis is very poor. You have to extract it. I don't know who has told like this. So there is a mismatch of treatment plan. And here the patient thinks that this doctor said something, now this doctor is saying something. When there is a change in the treatment plan for your patients, the way that it has to be put across to patients is such that we both are working together to understand what is the best possible treatment for you rather than coming across as two dentists fighting. So the consultant, if when I go, sometimes people call me for perio. When I go for perio cases, I find that there is no active pocket. There may be bone loss. It must be historical now. There is no pocket, but they would have already told this is flap surgery, and they would have already said all this. And I go there and see there are no pockets. So I'll tell them that, doctor, I understand why you thought maybe this pocket is done, but you see the bone loss here. Definitely, anybody in your page would have seen and definitely advised this. But when you look at clinically, I feel that let's try and adopt a non-surgical approach for this patients. Patients also will feel better, and then if it is definitely needed, we can do the surgery. But if you do non-surgical, maybe simple laser or something like that, we'll evaluate the situation and then take a call. Yeah, correct. So now, when the patient hearing this, they feel that I've come to the right place.
Correct.
Third common mistake that I find is many times people do follow-ups for their patients. So normally क्या होता है कि patient when comes and they say you advise a root canal or advise an ortho treatment or advise an implant, and patient says okay, I will think and come back, right? Then the next 2 days you call up the patient, next 3 days, sir आपने सोचा क्या, आपने did you think about it, when are you coming back, what are you doing, and things like that. You keep badgering the patient, which is wrong. Secondly, patient says okay and comes and pays for your treatment, undergoes the treatment, and after the treatment is completed, nobody is bothered to call and ask
Correct.
how they are feeling. So on one side, the patient feels that till the time I paid the money, these guys were calling me every day. And the moment I paid the money and completed treatment, nobody is bothered to ask whether I'm having pain or how I'm feeling. So having a structured follow-up program is very important. So you have a follow-up program for those patients who have come to your clinic and not undergone the treatment. You have a follow-up program for people who have undergone the chief complaint but not have come back for the other comprehensive treatment plan. And then third, you have a follow-up program for those people who have completed the treatment, and then you have to call up and check on how they are 6 months down the line, 3 months down the line, year down the line for your audit purposes to see how successful you are as a practitioner. You may have done 100 root canals in the last year, but 80 of them have failed or have shown signs of infection. That is something wrong in the way that your endodontist is doing. You are doing. Again, I don't want to have anything against endoware. I'm just saying, let's say periodontist, let it may. Okay, and there's a recurrence of pocket or anything like that. So performing good audits of your treatments with a strong follow program is the thing that is lacking in most clinics. You may be a small single chair practice, but still it's important to audit your services of the last 6 months, of the last 1 year, to understand where you've gone wrong, where you've gone right, how you can improve your services and things like that. Fourth mistake I see is always you see a periodontist. Periodontist in his practice will have only perio cases. Orthodontist will have a lot of only ortho cases in his practice. Endodontist will be focusing only on doing root canals. So when you are having a dental clinic, there must be a distribution of revenue across the departments. So you must do a proper business analysis to understand where your money, how much part of your money is coming from where. So for example, prosto, endo, ortho together should contribute about 60% of the business. General dentistry should contribute about 10-15% of the business. Perio should contribute 10-15% of the business. Oral surgery should contribute 10%. Pedo should contribute another 5-10%. So when you look at your overall revenue that you have generated, do an analysis of how much money is coming from which department. So this is not something that many people do, right? So these are some of the common. So once you do this and have a proper system, like I mentioned, have a consistency in doing your marketing, your sales, your operations, your R&D, maintaining your accounts and things like that. Having your focus clear and revisiting what your clinic should be over the next 6 months, or having a vision for the clinic, setting up a vision statement for the next 6 months or 1 year. These are things that clinics don't do. Most of the clinics don't do. They'll just go, open the clinic at 10 o'clock. आज patient आया, आज treat किया, आज पैसा लिया, घर गया. ऐसे करोगे तो जिंदगी भर यही करते रहोगे.
Correct. Absolutely correct, sir. And so we know that you have your academy by the name of Delta Dental Academy, and you do provide courses or trainings into this area. Would you like to speak a little bit more on that?
So yeah, we have we conduct a lot of programs on practice management, both for the new clinics who want to set up their practice on what should be the budget, how to structure your clinic, where to location identification, what are the licenses and stuff that you need, and for existing practices on how to build. We do a lot of courses on customer experience, business intelligence, um, many such courses. So these courses are run through Zoom now. Earlier we used to have offline events. Now it's more convenient to do it over Zoom. We also do individual practice consultation. So we take it as a 2-month project where I visit the clinic, I understand what are the requirements of the clinic and where they are lacking, and give them a customized report on how they can improve their practice, and give a 2-month follow up for each of the clinics to improve their practice. There are various levels of engagement that we do with private practices, existing private practices, or with students who want to set up their own practices.
Correct.
Yeah. So you can contact me if needed. I'm available on Facebook.
I'll mention all your relevant social links in the description so audience can check it out.
The thing is, information can be given, but how serious are people to take that information? A lot of people know, and nothing that I say is something that people don't know. But to follow it in a structured manner and to maintain consistency in that, that's the key.
Correct. Correct. So, sir, last thoughts in terms of how can dentists grow their practice efficiently and effectively?
Okay. So do unto others what you would expect others to do to you. So your patients come to you with a lot of faith and trust. Make sure that even if you are not the right person to do the treatment, get the right person to do the treatment in your clinic. But don't just do treatments for because they have come to you, or just because they said that you have to do. You're not morally obligated to treat everything of the patient by yourself. If it was the treatment was for your mother, for your father, for your children, for your brother and sister, what you would do, please perform this. Don't hesitate in asking for help, because as youngsters sometimes we make a lot of mistakes. I'm always available. I don't charge anything. It's free. You can always contact me or any of your seniors or your teachers. I'm more than sure that people will be happy to provide their assistance. Things. So do what you feel is right. Do a lot of homework. When you have no patients in the clinic, when you are sitting free, take multiple OPGs and start doing the treatment planning for each of those cases. Form a small study group, 5 people, 6 people, known people. Discuss once in a week. Discuss. You want me to do that? Approach me. I will do free of cost. Once a week, I will come. I'll sit with you. I'll offer you my services. I'll give you my OPGs. You can give me your OPGs. We can discuss 2 cases, 3 cases, 1 case, whatever, how much ever time permits. But the idea is you have to constantly learn, and maintain a book. Maintain a book of your learnings from every case, both clinically and business wise. So make a note so that when you maintain that discipline, uh, the idea is you have to be no person can achieve professional success if if they are not personally successful. So make personal changes in your life. Wake up early. Do get some discipline in your life. Focus on hard work. Do some exercise. Do some regimen. Get a routine going on, and that's when when you develop personally, your professionally automatically will develop.
Correct, correct. Absolutely correct. So thank you so much for, such important pointers and a very, very structured conversation. I mean, the conversation we had today is motivating me to start my practice now, which I left 10 years ago. So thank you so much for inspiring, for motivating, and giving such a wonderful structured conversation, which I think is highly needed in the times that we are currently. So thank you, sir, once again for coming on our channel and talking about it.
Thank you. Thank you so much for having me, Shirin. Always a pleasure.
And all the audience, I hope you also got motivated, inspired, and the pointers that he has mentioned in the session today is really, really helpful if you start implementing them in your practice. So thank you very much. for patiently listening. Please subscribe to our channel. It's absolutely free. Like and share this in your network because this might help out everyone who's practicing dentistry today. So thank you, everyone. I will see you in the next video. Until then, bye and good luck.